Department of Health Commissioner Jan Malcolm, Homeland Security and Emergency Management Director Joe Kelly, and Department of Corrections Commissioner Paul SCHNELL. We will then open it up to questions from the press, and as a reminder, please limit yourself to one question a reporter. And with that, Governor Tim Walz.
Thank you, Katie. Good afternoon, Minnesota. Once again, I'm sorry to say we have to report 4 more fatalities from COVID-19. Our sympathies to the families. Wanted to once again thank our press corps on here for continuing to get out a lot of good information. I just finished addressing the state to update where we're at during this time that they are buying us of the stay-at-home order, our ability to build up hospital capacity, all of the life-saving equipment from ventilators to masks that we need, how we're going to talk about testing and isolating vulnerable populations, and how we're going to continue to make sure we're providing the safety net for folks who are displaced by this. So I think what I'm going to do is I'm going to pass right on to Jan. I'm sure there's questions about the new updated dashboard or where we're at on some things, but I'll take those at the end. So with that, Commissioner Malcolm.
Thank you, Governor. Good afternoon, everyone. The global picture, as we talked about yesterday, has now passed 1 million cases in total around the world and over 54,000 deaths. The United States is fast approaching, probably has already passed by this hour, the 250,000 mark. We were at 246,000 confirmed cases early this morning, and about 120,000 of those in the New York, New Jersey region alone. The U.S. is reporting over 6,000 deaths, over 1,500 of those deaths in New York City alone. Here in Minnesota, we are now reporting 789 laboratory-confirmed cases in our state. That's an increase of 47 from yesterday, so on a similar pace of increase day to day. And as the governor said, we're very, very sorry to report 4 more COVID-19 deaths to bring our total now to 22. There were 3 of these deaths that were associated with long-term care residents. One in Hennepin County, an 88-year-old, one in Olmsted County, a 90-year-old, one Scott County, 86-year-old. Those 3 were residents of long-term care. And the 4th, a 60-year-old resident of Chisago County, not long-term care related, but an individual with significant underlying health conditions. As of today, 410 patients have been released from isolation. In terms of hospitalizations, as of today, there are 86 patients in the hospital today. That is an increase of 11 over yesterday, so a smaller rate of growth in hospitalizations from the prior day. An additional 2 patients in the ICU, so that is now 40 ICU patients, and 46 non-ICU patients, an increase of 9 there. In terms of congregate care settings, we have still 47 long-term care facilities reporting cases, so no new facilities added today. 31 of these facilities have 1 case, 8 have 2 cases, 8 of the facilities have more than 2 cases. And as we've said before, that remains a very intense focus for us. In addition to the long-term care setting, and we can go into additional detail there about the breakdowns between residents and healthcare workers in the questions if you'd like. In addition to those congregate care settings, we also have 2 confirmed cases among staff in corrections facilities, one at Moose Lake, one at Red Wing. We do have Commissioner SCHNELL with us today, so he, I'm sure, will have more to say about the work that's going on there, but suffice it to say that all corrections facilities are working hard to take appropriate preventive efforts to minimize mixing among units and improve social distancing, and our 2 departments are working very closely together to make sure that we can respond quickly to infections in these settings. In terms of a specific message that I'd like to mention today, and congratulations and thanks to the governor for helping to create a really integrated statewide COVID-19 dashboard that he has just revealed. In addition to the work that we've done at the health department to help populate that site, we're also continuing to add new information to the MDH COVID homepage, including, as I mentioned yesterday, we will begin over the weekend to list the specific long-term care facilities with outbreaks, as long as those facilities are larger than 10 beds. The situation update section of our COVID-19 site now includes a more robust set of graphics and charts so that you can see visually more how the epidemic is progressing in our state, and we'll continue to update and enhance that page as we go. Just a brief comment about masks. We've been seeing lots of discussion about masks in the media, and the guidance has been evolving as more is learned about the virus. And as we've said, wearing a non-medical grade mask is one way to practice source control for COVID. And so what that means is that when you are wearing a mask, it's not meant to protect you from catching the virus from others, and it's not a substitute for social distancing. However, if you wear a mask, it can protect others around you from you potentially exposing them if you happen to be ill or even might be ill and are asymptomatic and don't know it. So that would be like household contacts or people when you're out for essential services, for example. As we talked about, the mask helps to prevent respiratory droplets from coming into contact with other people by catching them in the mask if you were to cough or sneeze. But again, if you do decide to wear a mask to protect others, please do not use medical grade or surgical masks. These supplies are in high need in healthcare facilities and among first responders to protect those workers. And keep in mind that whether or not you choose to wear a mask, you really need to continue to socially distance, wash your hands, and follow the other isolation guidelines that we've kept on talking about. These are the really proven ways to protect yourself. Thank you. With that, I will turn it over to Director Kelly at the State Emergency Operations Center.
Thank you, Commissioner, and good afternoon, everyone. Yesterday, we held our latest conference call with emergency managers around the state. Twice a week, we get on the horn with them to cross-level information, answer questions, and gather up issues. It's important for us to stay in touch in times like these. Along those same lines, this morning I called my county counterparts up in the Red River Valley from Clay County and Moorhead up to Kitson County and Halleck. We chatted briefly about the impacts of the 6 to 8 inches of heavy wet snow and strong winds that they got hit with yesterday, and they're doing fine. Trust me, a little early spring clipper is nothing they can't handle. We also checked on local flood conditions because the Red River to the north and its tributaries are experiencing the most significant flood activity in the state right now. The good news is most of the streams and rivers in the valley aren't forecast to go much higher than moderate flooding. And of course, as always, we talked about their mitigation and response actions and concerns they have about the coronavirus outbreak. These weekly conference calls and the outreach like I did today are a good reminder that we need to be ready for anything, even while we're fighting the virus. And around the country, communities affected by the pandemic have not been spared from other natural disasters, tornadoes, floods, even earthquakes. And I want Minnesotans to know that your emergency managers and their first responder partners, we're keeping an eye on the horizon beyond the pandemic, and we'll be ready to react if another serious incident happens. Severe Weather Awareness Week, I know it sounds strange to talk about that in the context of a pandemic. It's coming up, April 13th through the 17th. And the signature event of that annual event are the statewide tornado drills. We sound the sirens and send out wireless emergency alert messages during the day when most of us would usually be at school or work, and then again at night when we're home. As of now, we're planning to conduct the tornado drills as scheduled on Thursday, April 16th, but we'll evaluate the wisdom and appropriateness of that as we get closer to the day. As I said, we're not immune from future emergencies and disasters just because we have our hands full with this thing. We need to be ready for anything, and I'm confident we will be. Next, you'll hear from Commissioner Paul SCHNELL with the Department of Corrections. Commissioner.
Thank you, Joe. Good afternoon, everyone. In keeping with the governor's emergency declaration, the Department of Corrections has fully activated its incident management team, who've been really busy over the past several weeks. I'd like to start off by just providing you a little background and update. Each of our wardens have developed and are implementing what we're calling stay with unit plans at each of our correctional facilities. This is the prison version of a stay-at-home plan. Minnesota's prisons have been in operations for between 30 and 125 years, and all of them have different living conventions. Some single cells, some double cells, dormitories holding between 4 and up to 100 or more incarcerated people. But no matter what, we do call and recognize that each of our prisons are divided into living units. Under normal circumstances, incarcerated people from different living units can be intermingled for certain activities. For instance, they may go to the dining hall together, educational programming, or industry or other work opportunities. But with the close quarters in prison, this intermingling can allow for a virus like COVID-19 to spread quickly, as Commissioner Malcolm mentioned. With the stay with unit plans are designed to minimize the potential for spread of COVID by increasing the opportunity for social distancing, number one, and number two, to provide for unit level separation, which decreases the potential for serious outbreaks throughout a facility, and also improving our ability to plan for the possibility of a serious outbreak occurring. As Commissioner Malcolm mentioned, we've been really working closely with the Department of Health to implement measures to minimize risk of exposure and spread of COVID-19. We know that public safety and public health are not mutually exclusive, which adds additional complexity in the prison setting. As it relates to those in our facilities, there are some who may say we should just lock them in a cell and feed them sandwiches and hope for the best. But the U.S. Constitution, Minnesota law, human rights standards, and the teachings of most organized religions call for humane treatment of those in our prisons. And we must recognize the reality that 95% of these people currently living in our prisons will one day return to communities across our state. The men and women serving these sentences in our prisons have people on the outside who love them and care about them, and we know that those incarcerated also worry about their own family members in light of COVID-19. Accountability for violations of our laws and the harm caused to others are important criminal justice objectives. But we take seriously our responsibility to rehabilitate, and for that reason, we've taken the steps we've taken. I'd like to touch on one other issue. Though the DOC has a long-established pandemic plan, COVID-19 presents new challenges and risks. 75% of our population in prison is under 45 years of age. But a significant portion of the population has serious underlying medical conditions, which puts them at potentially higher risk than others. To manage spread and improve the ability to protect the most medically vulnerable, we've taken steps to maximize capacity and options to allow for quarantine or protective containment. We've also started reviewing candidates who are serving sentences for nonviolent crimes and are within 90 days of regular release for placement in the DOC's long-standing work, education, and vocational training release program. Our current plan really focuses on two areas. One is to manage the state's prison capacity strategically to meet the potential for infections rates that might develop in our prisons going forward. And two, keeping those incarcerated connected to their families and loved ones, providing them with time for recreation and education, chemical dependency programming, and therapeutic programming. In response to this crisis, public safety and public health are the Department of Corrections' core objectives. Just a few stats, and then I'm going to turn it back to Governor WALZ. At present, we have Moose Lake has 7 confirmed positive test cases of inmates and 13 inmates that are presumed positive based on symptoms. There is 1 staff person confirmed positive at Moose Lake and 1 that is presumed positive with symptoms. In Red Wing, 2 staff members have been confirmed positive. There is none of the youth inmates in Red Wing were affected or at least tested positive or showed any symptoms. They have been quarantined, however. And I would just say that, fortunately, at this point in time, there are no positives at any other correctional facilities. And we have tests pending at just 2 of our facilities, that being Stillwater and Lino Lakes. And with that, Governor, I turn it back over to you.
Thank you, Commissioner Schnell. Thank you, everyone. And at this time, I'd open it up for questions.
Operator, we're ready for questions.
Thank you. As a reminder, to ask a question, you will need to press *1 on your telephone. To withdraw your question, press the # key. Please stand by while we compile the Q&A roster. And the first question comes from the line of Bill Werner of Minnesota News Network. Your line is open.
Good afternoon, Governor. Thank you. You, I'm sure, are aware of the President's order under the Defense Production Act regarding N95 respirator masks. Is that going to cut into the supplies that Minnesota will need? And if it does, what would be your stance as Governor of Minnesota on that?
Well, thank you, Bill. We're still trying to assess exactly what it means. The President had resisted using that, and now it came, I think, kind of as a surprise to many. I reiterate this. The President has numerous times said that they're a backup. The states need to go get their things. What you're hearing from governors across the country is when we're trying to do that, we're competing against FEMA. Now, of course, 3M being right here in our backyard is being told that all of theirs will go to FEMA. So we're assessing that, as I said earlier on my presentation, that roadblocks are being thrown up. I have to figure out ways to go around them, but this is a concern. We have not yet had all the time to assess exactly what it means, but this is the ever-changing landscape of a very fragmented supply chain system. So we'll take it in stride again, but we'll get more information, and I will certainly pass it on when we do.
Thank you.
Our next question comes from the line of Walker Orenstein of Minnesota Post. Your line is open.
Hi. So on the dashboard for critical care supplies, it says one of the categories is awaiting delivery. Can you talk about where those deliveries supposed to be coming from, and how likely we are to actually get them? Are they coming from companies, or is that from some sort of federal stockpile?
Yeah, no, thank you, Walker. I'll have Jan, and we may even have Commissioner Alice Roberts-Davis on here, who is managing our procurement. If either one of you would like to answer that, to break down a little more granular on those procurements.
This is Commissioner Alice Roberts-Davis, and I will take the question. Governor, thank you for the question. The supplies are coming from a number of our trusted vendor partners as well as corporate partners who have been assisting us through their different channels and leveraging their networks to help us find the products that we need.
Thank you.
Our next question comes from the line of Matt Satik of Minnesota Public Radio. Your line is open.
Hi there. I have another question about the health plans and the agreement that you announced yesterday. I'm wondering, is any sort of state reimbursement part of that deal by the plans who've agreed to waive in-network coronavirus testing and care for COVID-19?
Thank you, Matt. I don't believe I have Commissioner Kelly on this. I don't have the specific on it myself right now. If I'm not sure, Jan, how involved you were when they were making that decision, but if not, we'll get right back to you, Matt.
Okay. And what can you say, was it part of the negotiations at all, if not?
Governor, this is Jan. Commissioner Malcolm, I do not believe that there's any state reimbursement involved in that response. A number of the health plans had voluntarily stepped out to waive those copays earlier, and so the more recent development was that all the plans collectively agreed to do the same thing. As far as I know, that does not involve any state reimbursement. If that's incorrect, we'll get back to you on that.
Okay, thank you.
Our next question comes from the line of Tom Hauser of KSTP-TV. Your line is open.
Hello, Governor. A quick follow-up to Bill Warner. Have you talked to the CEO of 3M, and was Minnesota getting any masks directly from 3M? That's just kind of a follow-up to Bill's question. But also on unemployment, I don't know if Commissioner Grove is on the line or not, but there's a lot of people who've written in saying they got laid off late, so they're getting their unemployment insurance claims in now and not getting them processed as quickly as the people who got in earlier. Is the state ramping those efforts up and providing more phone lines and making it easier for people to get through, and especially for people who might not be online, as odd as that might seem, who need to do things by phone or on paper? Thank you, Governor.
Yeah, I'll answer first on 3M, then I think Steve is on, and I'll just a mention on that unemployment insurance. I have not spoken to Mike Roman at this time. What I can tell you is that 3M had upped there and doubled their production. I believe the date was January 20th. So I know that they had already, before anyone else was responding, or at least certainly federally wasn't. But I've not spoken to them about the current situation. I, again, need, and our team will, and of course, Commissioner Roberts Davis is leading point on this to understand exactly what this means. These are concerning. This is echoed by governors across the political spectrum, across the country, that we're being told to go out and find these ourselves. When we find them, we're getting outbid by the federal government. Now, they're shutting off a source right here in Minnesota, apparently. But at this time, I don't have any more follow-up. I'm going to turn it over to Steve on the unemployment side, if you're on, Commissioner Grove.
Yeah, thanks, Governor. I am, and thanks, Tom, for the question. Just a brief update to everybody. We are up to 320,043 applications thus far. We had about 22,657 come in yesterday. So you're right, the numbers are rising, and the ability of our team to process these applications continues to be stretched, but I can tell you we are adding people by the day to that team, 50 staff this week, and as much expected next week, adding to that team of people that is processing these claims at an incredible speed given the amount of work to be done. We have thousands of hours of overtime at play right now. We've expanded our application window from 60 hours a week to 84 hours a week, adding new servers to the system to handle the load, and making a lot of shifts to our system as well to ensure that people have a better customer service experience. But as the governor said a moment ago in his message to Minnesotans, we care about every single claim. We want to get every single claim right. And so we're going to work hard to make sure that each person who applies has a good experience, gets the right answer, gets the right money. And importantly now, as we shift to this new phase where federal funding is coming into the CARES Act, we're preparing very quickly to be able to issue those additional $600 payments that are going to be coming through the federal government, extend those benefits from 26 to 39 weeks to that 13-week extension, and I think most importantly, and on so many people's minds, provide benefits to independent contractors and the self-employed who are not typically eligible for unemployment insurance, but under these new federal guidelines will be. We're still waiting on guidance from the Department of Labor on that, but we know they're working on it, and we are doing all the things on our end on the backside technically to be prepared to issue those payments as soon as we get further guidance from the federal government. So, this is a challenging time for Minnesotans. We want to treat every application and Minnesotan with the respect and speed that they deserve and process these applications as fast as we possibly can.
Are there accommodations for people who are not online?
There are. There's a call-in number for those who are not online, and we do ask that those who are online not use it so that those who don't have connection to the Internet can find a way into our system. The call lines are also there when there's some language difficulties, too. So we're trying to keep those phone lines open for those who don't have access to the website, but if you do, it's uimn.org.
Thank you both.
Yeah, Tom, I would just follow up, and the reason I mentioned earlier, and with the commissioner, because I talked to my team, this is when we just need to produce results, which they're doing, and not, this expectation of, wow, look at the great job. I tell them, though, when we're offline, just to be clear, this is unprecedented. And when I'm talking to governors from other states, and I saw several stories yesterday, Connecticut has not yet processed a payment. It's 3 weeks behind. The system in Florida crashed in its entirety today. Most states' UI have crashed, and I think, again, the commissioner gives me some data. We're the fourth lowest now today, because we got on this early. We made a quick decision to do it. We waived the week, got on early. But I want to be very, very compassionate. Again, 99 people got their check. The one person who didn't have a miserable day, and we need to help them. So we'll keep pushing. We'll keep expanding out and keep putting out ways that they can get cut. Thanks, Tom.
Our next question comes from the line of Brian Back of Minnesota Public Radio. Your line is open.
Hey, Governor, what are you weighing as you consider extending the stay-at-home order? Should people expect that it will be identical in scope? And are you concerned that there are 3 bordering states that have yet to introduce similar restrictions?
To your last question, yes, I am. And I talked to a lot of governors. I have not spoken with Governor Reynolds or Governor Nome. I have spoken to Governor Burgum. Our team is talking to Iowa, and so there is communications going on. I do worry about that. I think it's probably only a matter of time that you've seen that they will issue those too. And I think what I said today is that we're using the federal standards, but trying to adapt. And I know folks write in and they're asking, landscapers who work alone, golf courses, some of these things come up. We're trying to figure out what's the best science, what's the best health advice to keep people safe, but what is the most sustainable, because this is going to get really hard. And I don't think I'm probably speaking out of line here that I think, again, much like I talked about school, there's certainly a probability that we will at least, go to the CDC standards, the president's place, where they went to the end of April. But I think that we're trying to be thoughtful with the data and modify away. And again, a lot of this depends on how well Minnesota simply adhere to it without us telling them to, so that they're not jeopardizing the gains that we're making. So I think we want to see these border states move to it, and I think they will. We'll take a look at what the order looks like, and as I said, we'll keep adjusting as the situation adjusts. If we got something wrong in this, or if there's a way that the health people tell us we can make changes, we will.
Our next question comes from the line of Dave Orrick of Pioneer Press. Your line is open.
Hi, thank you. Commissioner Malcolm, the case for covering your face is pretty good in terms of if everyone wore one, something over their face, then we would, presumably asymptomatic people would slow their ability to spread it pretty well. This is not a very comfortable thing for people in Minnesota, white people in Minnesota in warm weather to do. I wore a bandana out yesterday, and I got a lot of funny looks. Why don't you just recommend that people start wearing something like a scarf or balaclava or bandana over their face now, so we can kind of get used to it?
Well, that certainly is something that the public health community has begun to talk more about just in recent days. As you say, one could take the position of, well, there's certainly no harm in doing that. I think our concern has been to really make sure that people understand what the masks do and don't do, and that if folks want to start wearing a mask, it's not to protect themselves from someone else, it's the other way around. And that's just not a substitute for continuing to not gather in groups and to continue to do social distancing. And really the critical thing is if we are, more of us or all of us, going to start wearing those masks to protect others, they really do need to be homemade masks, are certainly not the medical grade supplies that are in such short supply. We're taking a look at that. I think what we've been saying is if you understand what it's for and what it's not, and you're still taking the other precautions, it's another good neighborly gesture to think about doing that to protect others.
Okay, thanks.
Our next question comes from the line of Kate Jude of KNSI News Radio. Your line is open.
Thank you very much, Governor, for taking my phone call and taking my question here. My question is, looking at the data chart that you guys have set up here, about 31% of the cases appear to be from community spread. Do we know how those cases are being spread through the community? Do we have any idea? And we have a source here that's told us, at least at one hospital in the state, that they're beginning to look at this as possibly being an airborne type of disease and kind of treating it like that. Can you comment on that at all?
Yeah, thank you. I'll defer to Commissioner Malcolm on this one.
Yep, thanks, Governor. And Chris Ersman's on the phone as a resource, so I will invite Chris to chime in as well. But the community spread means exactly that we don't know for sure a source of transmission. It's not from a known confirmed case. It's not from a known travel situation. So therefore, it is presumed to have been passed some other way, either from somebody, as we talked about, touching a surface. And then touching eyes, nose, mouth, or being in close proximity to someone who was transmitting the virus. In terms of, is it airborne? I think that's, again, a subject of an intense study right now. I think what I've heard, and I would ask Chris to just comment on it, and we can certainly get other resources on the phone in the future, too, to talk about the emerging science, but that we still would be talking about really aerosolized droplets, not particles that just float in the air and stay in the air for long periods of time, as is true for some other diseases like measles. So, Chris, would you like to chime in?
Sure. Yes, what Commissioner Malcolm said about community spread is exactly right, that these are individuals that don't have any other likely source of exposure, and they have not left the state. So they have not traveled internationally. They have not even traveled domestically. They have stayed within the state. And I think it's important to keep in mind, as you're thinking about community transmission, we currently have 36 counties in which we've had cases identified as having community transmission. So we know that this is, occurring across the state. And for many of these counties, the very first case that we identified was community spread. So, for instance, there's been a lot of attention to Martin County. The very first case in that county was a case of community spread, which suggests that the virus has been circulating and being transmitted within that community before the first case was even detected. And so when something like that happens, you're kind of past being able to fully contain the virus. And then just one other comment about airborne spread that the commissioner mentioned, and that is just simply to say that, as she said, while there has been talk about this, it's something that's being looked at, and certainly aerosolization of the virus is a strong possibility. I can tell you that, having worked on the 2017 measles outbreak, that I think that if this was if airborne spread was the most predominant or the main mode of transmission, we would have seen even more cases than we are now. That's not to say that that isn't an important element of how it spread, but I think unlike measles, it's not the main mode of spread, because I think we would have seen a little bit different pattern of transmission.
Okay, thank you.
Our next question comes from the line of Emily Habit of Care 11. Your line is open.
Hi, Governor and Commissioners. This question, I think, is for Commissioner SCHNELL. When did you implement the Stay With Unit across the DOC? Was that on the same day that the Stay at Home was implemented? And then are you considering releasing anyone either with underlying conditions or maybe who's a nonviolent offender who is not within that 90 days of release?
Well, thanks for that question. The Stay With Unit really is a new initiative. We started out by really trying to control some of our movement, but the initial goal, both here and really across the country with departments of corrections, was to try and maintain as much programming as possible and limiting outside visitors and contractors and so forth coming into the facilities. So full implementation of Stay With Unit It started in Moose Lake this week and will now be rolling out early next week at all facilities across the system. As it relates to earlier release, we are right now focused strictly on that within 90 days of release. We know that these people are coming out. Release planning is in process for them, so we're not putting additional burden on the supervision system. And so we are focused there. There is a provision in Minnesota law for conditional medical release. Those provisions are being looked at, and what conditional medical release may mean in a COVID-19 environment. So we have received a number of petitions for that, and we are looking at those in accordance with the law.
Thank you, Commissioner SCHNELL. Can I just follow up? So if Stay With Unit is just being rolled out now, what measures have been taken already as stay-at-home has been implemented across the state? Have there been limitations on how many people are gathering to eat or on how staff are being screened when they come in?
Yeah, from the beginning when we put this in place, staff screening started right away with questionnaires. Hand washing stations, sanitizing stations were put in place. We did a lot of outreach and education with both our staff as well as those that are incarcerated. So there was a number of initiatives that took place very early on. Because we're more contained with the exception of staff coming in and out, visitors was one of the places where we had significant concern, and then we modified programs as this developed. And just yesterday we initiated the mask distribution to all staff and all incarcerated people across the system.
Thank you. Can you just speak to the meal times, what's being done there?
Yeah, so meal times right now are being handled with many of the facilities have begun to allow those people who feel that they're at greater risk and would prefer to be fed in cell. That has been, those arrangements have been made. And then we're splitting the dining periods so that what may have taken a half hour to feed 200 or 300 people now may be done in 3 cycles and could take an hour and a half. So this will have impact if this will modify our programming, modify our schedule, so things will take a little bit longer. But we think ultimately it will help us to maintain a higher level of social distancing, as best at least as that can be accomplished within a prison setting, and ultimately minimize the risk of spread.
And is that rolling out now, or has that already been rolled out?
It is rolling out now. Some facilities, Moose Lake began doing some in-unit feeding, I believe, in the last couple of days.
Thank you, Commissioner.
Thank you.
Our next question comes from the line of Betsy Singer of ABC6 Rochester. Your line is open.
Good afternoon, Governor and Commissioners. Governor, as you look into extending your stay-at-home order, and maybe next week we'll announce something, your hotline has been flooded with calls of people turning in people, and Senator Gazelka wants you to take that down. Any chance that you may take that down? And what happens when someone turns in their neighbor? Are there any repercussions that happen?
Yeah, thank you, Betsy, and thanks for joining us. But first of all, the reason that we set that up mainly was because our 911 lines were being overwhelmed with it. So we put it there, and a lot of these are questions that people are asking. It's a lot more questions or asking why certain stores are open. I think it's where there's no clear-cut line. We use the federal standards around essential businesses, but we're trying to be adaptive in this environment. So the volume of those calls is for that. And law enforcement, as I said, we don't want them just strictly on this because Minnesotans, for the most part, are adhering. But what happens is they go out and they try and educate people. And it might be a soccer game. that people are on, or it might be too many people congregated in a park with children. So we take those on. So it's, again, if we take it down, the 911 lines will be called in because people are still going to call. This just gave them a place and let us separate out the true emergencies on 911 with the issues around the stay-at-home order. So I think it's working. I think Minnesotans, again, this isn't, we always told our children when they were going to school that sometimes you tell to keep people out of trouble and other times you tell to get them in trouble, and you need to know the difference. I don't think most of these people are calling to get people in trouble. They're calling to keep them safe. So we don't have any intention at this point in time of taking that down.
Spoken like a true teacher, Governor. I appreciate that. Just a quick follow-up since I have you on the line. Sorry, Teddy, but I'm going out of context a little bit. You said yesterday, Governor, that you met with spiritual leaders. This is the second time that you talked about the spiritual side of this. We know about the physical. We know about mental health. What is it that your spiritual leaders are talking to you about?
Yeah, this is an important part of the component of people's life and their healthy well-being, their physical, mental, and spiritual health. And they're just trying, like so many others, how do they deliver that? And there's a component, I think, of community gathering. I think they're concerned as we approach, Passover, Easter, Ramadan, that these are, yes, spiritual times. They're also very much community times. So they're trying to understand, like everyone else, what can we do safely? What can we modify to make sure that people have that part of their life, ministered to, because people want to do that. And this is especially challenging in issues around funerals. Certainly it's easier to postpone a wedding, but those are important. We have, first communions, all kinds of rites of passage, bar mitzvahs. How are we handling that? So what I'm trying to do is to understand from them what they're doing, what the state can do to enable them to do that. But this is an important component. It's part of who we are as humans, and these are folks that are advising me on what we can do to make sure that's being addressed.
Governor, Commissioners, thank you so much for taking my call.
Thank you, Betsy.
Our next questions come from the line of Kevin Federley, Minnesota lawyer. Your line is open.
This is for Commissioner Schnell. I talked to Teresa Nelson at the ACLU, and she suggests that your interpretation of statute is perhaps a little narrow, that perhaps you have more power than you suspect you have or that you believe you have. I wonder about that. I also want to find out, I want to kind of outline what powers you have now. There's been discussion about releasing people at 30, 60, 90 days. I don't know if those are people on technical violations or if those are people, as you suggested a minute ago, are in the process for release. And what powers you would like to have, either by dint of executive order or through legislation. Kind of define that for me. What power do you have now? What power would you like to have through either of those two mechanisms?
Well, thanks, Kevin. I think, first of all, in terms of the ACLU kind of concern, I think they're speaking more there about conditional medical release. And we do have the Attorney General's office and the General Counsel at the DOC and others looking at that proposition of conditional medical release generally requires a person to have a grave medical condition. Now, some are arguing that the presence of COVID and the implications of COVID, along with serious or significant underlying medical condition, that the combination of those two things result in a condition being potentially grave, and then that would necessitate or authorize a review. There are other elements to that statute as well. There's a public safety review. There is a release plan that the person has to have a place to go, and that ultimately that the costs are borne by a system other than the Department of Corrections. And generally speaking, that has historically been used for end-of-life types of placements, is how conditional medical release has been used. We are, as I said, having the lawyers take a look at that and do some assessment of it. In terms of the 30, 60, 90 days, it's really those people that are within 90 days or less. First is the option to look at those people that have not yet been released but would be eligible for work release. And as I mentioned, we have used work release in Minnesota and across the country for decades. as a pre-release program. It allows for people to have transition time. They enter the community. They may begin to do job search. They may begin to engage in treatment programs or community support programs, re-engagement with family. There's a variety of things that people are engaged in during this work release period. Those people would be coming up on their supervised release date, or their traditional, more or less what others might call parole date, within that 90-day time frame. And their supervision plans for post-parole or post-supervised release is in planning and under consideration. So it would be an opportunity for them to be released up to 90 days early. Now, I want to be really clear that this is really the purpose of doing this is really about trying to get capacity within the facility should we have a large-scale outbreak. And I think we have to, when we look at our population, recognize that while, as I said earlier, while oftentimes they're younger, on the whole, we also have people who have really profound and serious medical conditions, and we need to be able to have the flexibility and space to move people around for quarantine and containment. Technical release violators is another area that we are exploring. And what technical release violation consideration, and we do this all the time, this authority has long been part of the DOC and is used regularly in conjunction with supervised release or probation agents around the state and staff from the Hearings and Release Unit at the Department of Corrections who fall under the authority of the Commissioner's office. And those technical violators, we would simply be looking at restructuring of the terms and conditions of their release, verification of their plans, and whatever needed services that they could access so that we avoided future problems upon re-release. So those are just some of the strategies. In terms of expanded authority, I know that there has been proposals put out that the legislature, or at least the House, we're aware, may be looking at some language. But at this point in time, we have really been focused on the authority that, one, has been long used by the department, although we'd be looking at expanding the use of that. And we think that as a starting point, this is where we really need to focus. And we will see where this thing goes in terms of outgrowth and outbreaks that could occur. And as the modeling may suggest, both for the state as well as for the correctional facilities, we may need to make other decisions. But I think right now it's just important that we start with focus on these nonviolent, low-risk people that are coming up on their release date anyway.
Thank you. That's all I have.
Our next question comes from the line of Brandon Stahl, Chair 11. Your line is open.
Hi, thank you. Commissioner Malcolm, the testing situation you outlined on Wednesday seems quite dire to me. I'm wondering if there's, I know it's only been a couple of days, if there's an update. And second, if we don't have mass testing available, can we reasonably expect to go back to any kind of normal way of life, to reopen businesses or schools? And then, Governor, for you, what metrics or benchmarks are you looking for to reopen schools and businesses?
Governor, I'll start. We've really been focused on trying to help Minnesotans understand that there are big constraints on our ability to test as much as we would like due to the various supply issues that we've talked about, whether that's supplies in the laboratories or supplies in the healthcare workforce in terms of their ability to collect the swabs and so forth. So the governor has mentioned what will help that situation is the development of additional kinds of tests that aren't just about testing for do you have COVID right now, which is what the nasal swab tests are doing, but also the serology tests, the blood tests that are being developed now that will enable us to know if someone has had COVID, even if they didn't know it. And again, remember that a pretty significant percentage of the population has mild cases, so mild they may not even be aware that they have it, and that's part of what makes the spread so tricky. is that people can be spreading the virus when they have very mild illness themselves, or even potentially in a relatively few, but still some cases of apparently of asymptomatic spread. So those cases, those testing methods that would allow us to test for past exposure will be really, really helpful. And in addition to that, we talked a little bit, maybe we can talk more on a future call about the other things we're doing to try to build up our intelligence on where the disease is in Minnesota, where it's been, through what we refer to as syndromic surveillance. There's a whole bunch of other data that we have and are building up right now that give us a picture, in addition to laboratory confirmed tests, of what else we know about the prevalence of this disease. As the flu season winds down, and it is winding down rapidly, as we're surveilling for other influenza-like illnesses, we can pretty well assume that a lot of those influenza-like illnesses that haven't been diagnosed as COVID from a lab test are in fact COVID. And I would invite Chris to chime in and add anything else that you'd like, and then turn it back to the governor.
Thank you, Commissioner. Yeah, I was as you were speaking, I was thinking of the data that we currently have on influenza, and what we've seen is that data specific to influenza has really declined, and precipitously, actually, so that we think that social distancing has made a very big difference with that disease. But then we are also seeing other indicators, such as visits to providers for influenza-like illness, and that continues. And so that tells us we're not seeing influenza based on the laboratory testing, but we are still seeing people go in with respiratory illness, and as the Commissioner said, that suggests COVID. And there are multiple other indicators that we will be looking at that will give us information in the absence of laboratory testing. And while we would like to see more laboratory testing, the reality is that we may not, and so it's important that we have these other tools, because the governor does need good information for decision making.
And Brandon, I will follow up, because the question you asked, I think, is the one that most of your listeners out there, those folks that are paying attention, they want to see a light at the end of the tunnel. How are we going to know when it's time to be able to go back? And you asked about benchmarks. I think we first of all need to have that serology test. If we can identify who has immunity, that's a game changer. And we in Minnesota are going to focus heavily on that because we have the nation's focus at Mayo Clinic already on it. The real-time, 15-minute testing is going to be a piece of that, and then watching lessons learned from elsewhere. I'm staying in contact with people I know in southern China and watching the resurgence on the second wave. There's going to be good researchers and epidemiologists that put all of that together. Once we get to the point, too, with some of the therapeutics, if this didn't just kill so many people, there would be the ability to approach this differently. If you knew that the vast majority were going to get sick and that it wasn't going to be thousands die, you could address that. And I think as we see this move from day to day, some of the new research, some of the new things you hear Chris and the Commissioner talking about, we want to put those in. I am really, really focused that we simultaneously have a second track looking for not just the, we're going to manage it, we're going to triage, we're going to save people in the short run, but what does the end state of this look like? So we're putting a lot of effort into that, and those benchmarks of immunity, real-time testing, lessons learned, and then mortality rates starting to drop will be things that we will look for. And so far at this time, there's the few places that have opened back up again have seen a resurgence. But again, I remind people, for us here, it was that last week of December, first week of January, we started becoming very aware of this, and we're going from there.
Operator, we have time for one more question today.
Thank you. Next question comes from the line of Jeremy Olson, the Start Fund. Your line is open.
Hi, this would be a question for Director Kelly, if possible. A few days ago, you talked about the current status of spillover hospitals being created. Quick update on the numbers of that, but you also said you hadn't done any work yet on figuring out how to staff them. How are you going to solve that? I mean, there aren't a lot of extra nurses just sitting around, or are there? How are you going to get the people to these facilities if and when they end up being needed?
Well, the good news is there are a lot of caregivers who are working in non-hospital settings, clinics, ambulatory surgery centers, and other places that as healthcare facilities have curtailed elective procedures, many of those people have been laid off. I think Commissioner Grove has commented that some of those healthcare professionals are in one of the higher groups of the newly folks who are applying for unemployment insurance. So we also have some other options with Medical Reserve Corps, volunteers, retired medical professionals who have raised their hand and said, if you need me, I'll come back. So we are more hopeful, and the doctors and others on the team are working with those other sources of healthcare workers.
And do you see them being a group that you can just send to one of the facilities when that particular region has needs, or will each facility have its own staff ready to go?
Well, I think the whole plan will be to activate those centers and move staff and other equipment and supplies to them as needed. I don't think it would be prudent or maybe even possible to stand up all the potential sites at once. And if there's an area where they're needed, we'll activate them, and if not, we'll stand by and have that plan, if you will, in our pocket, ready to execute it if we can see the need coming.
Commissioner Grove, are you still? Yeah, thanks, Teddy. I was just going to ask, Commissioner Grove, are you still on?
Yeah, Governor, I am.
Well, I'm a bit unorthodox here, but I get texts and social media sent to me, and I had someone ask, they said, Commissioner, that they understand, they're happy how everything's going, but folks who applied but something went wrong aren't able to use the call-in line. They're saying the customer service line is not taking calls from those who've already applied. What kind of guidance should we give to folks if they're experiencing that?
Yeah, it's a great question, Governor. We were getting that question from a lot of people. We, in the last week, had to divert all of our call center employees to new application technical issues, because that was the thing that was slowing down payments the most. And so we've had to shift our call center to those calls this week, although I'm happy to report that next week we're going to be opening up that information line again starting Monday, such that calls like the one you're referring to, Governor, will be picked up at a faster frequency, and will be open for those kinds of issues that people are navigating. So it's a shift that we had to make to process as many applications as we could on the front end, and now that we're getting into a place where numbers are dropping a little and we're firing on all cylinders of the program, we want to make sure we can answer those kinds of questions by shifting our call center strategy next week.
Thank you, Commissioner, and thank you for everyone who's on here today. I'll be back with you again on Sunday night for an unusual state of the state, but one that I think is absolutely appropriate. I've been closing these with great stories. This one comes from a Fox 9 report, showed residents in the North Loop who are going out every night at 7 p.m. on their balconies or front lawns and banging on pots, clapping and cheering for our healthcare workers. Thank you, folks in the North Loop. Thank you for recognizing those folks on the front line. And as we always say, make sure we're taking the time to understand just what some people are going through. I know all of us are being put off. There's the disruption and the pain that goes with this, but there's those folks out there saving lives every single day. So we'll see you Sunday night. Stay home and stay healthy, Minnesota. Goodbye.
This has been a WDIO News Special Report.